What is a stem cell transplant for relapsed Ewing sarcoma? Imagine a treatment that allows doctors to deliver much stronger chemotherapy to fight cancer that has come back or spread after initial therapy. That's what a stem cell transplant aims to do in cases of relapsed Ewing sarcoma. This procedure starts with collecting healthy stem cells from the patient's own body, a process called an autologous transplant. These stem cells are stored safely so they can be used later. Next, the patient receives high-dose chemotherapy. This powerful treatment is designed to kill as many cancer cells as possible, including those that might have survived previous treatments. But this intense chemotherapy also destroys the patient's bone marrow, which is responsible for producing blood cells. Without a functioning bone marrow, the patient could face dangerous infections, anemia, and bleeding problems. That's where the stored stem cells come into play. After the chemotherapy, the preserved stem cells are infused back into the patient's bloodstream. These cells travel to the bone marrow and help it recover, producing new healthy blood cells. This process is called stem cell rescue or engraftment. Most often, doctors use the patient's own stem cells for this procedure, which is called an autologous transplant. Using donor cells, known as an allogeneic transplant, is less common for Ewing sarcoma because of higher risks and complexity. Research shows that high-dose chemotherapy followed by stem cell transplant might improve survival for some patients with relapsed or metastatic Ewing sarcoma. Some studies suggest that about 40 to 50% of patients could be event-free at 2 to 3 years after treatment, but these results are still being studied. It's important to remember that this approach is not yet standard care and is usually offered within clinical trials or specialized centers. The procedure does carry risks, including infections, organ damage, and even treatment-related death. Because of these risks, careful patient selection and close medical monitoring are essential. Currently, stem cell transplants are considered experimental for Ewing sarcoma and are not part of routine treatment. They are part of ongoing research efforts to find better ways to treat this aggressive bone cancer. In summary, a stem cell transplant for relapsed Ewing sarcoma is a way to give very high doses of chemotherapy to try to eliminate resistant cancer cells, then restore the bone marrow's ability to produce healthy blood cells using the patient's own stem cells. While it offers hope, it remains an investigational approach that should be considered within clinical trials or at specialized cancer centers. Always consult with oncology specialists to understand the best options tailored to individual cases.